Hi, my name is LaCrista Granberry. I am 17 years old and I suffered major depression for about 6 months. My experience during depression was long and sad. I cried a lot. I cried myself to sleep, woke up crying. It was painful because after crying so much, I got headaches. I stopped smiling and laughing a lot and ate a lot to get over the stuff I was going through and just became this angry person. I overcame depression by reading the Bible, praying, getting more involved in church.
There are two main theories about the causes of depression. The first theory has to do with the chemical imbalance in the brain, whereby a person lacks certain neurotransmitters that help to develop happiness or feel a sense of happiness. And when they don't have those transmitters, they are at increased risk of developing depression. The other cause, or the other theory out there, has to do with the way that a person is brought up or nurturing. So nature versus nurture. And if they don't develop particular coping skills during their development, they're not able to cope when certain stress. So when a patient comes to my clinic with a complaint of depression, there's a mnemonic that we use to remember all the questions to ask. So the mnemonic that we use is SIG-E-CAPS. SIG is S-I-G-E for the middle initial, and then CAPS, C-A-P-S. So for the first part, SIG, the S is the question that we ask about suicidality. So once a patient has said, yes, I do feel helpless or I do feel hopeless, I do have crying spells and all those other things that are commonly thought of with depression. The I stands for interest, and a lot of times depressed patients feel a loss of interest in the things that they enjoy doing at one point in time. The G is the next step in SIG, and that is a question about guilt. Oftentimes people with depression feel guilty about certain things and don't really know how to work through that. The E stands for energy. Patients with depression often feel a sense of like a loss of energy or feel just fatigued and tired. The C for the CAPS portion. The C stands for concentration. A lot of times depressed people complain of just not feeling like they can concentrate or forgetful, not able to, do math like they used to, or just having trouble with concentration. The next one is A, and that stands for appetite, and that can go either way. So some depressed patients feel like they've lost their appetite and they don't eat as much, or they don't eat at all, or they just don't feel like eating. And then on the other spectrum, sometimes people's appetites are up and they eat a lot or eat constantly. The next letter is P, and that stands for psychomotor retardation. And with psychomotor retardation, the retardation part of it is just slowing. So they can be slow in the way they speak, they can be slow in the way they walk, or slow to do things. They just seem slow. And then the last letter is the other S, and that has to do with sleep. And that also can go either way, just like appetite. So you can have a loss of sleep where you just can't fall asleep, or it's hard for you to stay asleep. Or on the other end, you are just sleeping way too much and sleeping is all that you want to do. Well, once I've diagnosed someone with depression, after they've answered yes or no to the questions that I asked them within SIG-E-CAPS, and it's happened over a certain period of time, I can say that they have depression. And there are many ways that we treat depression medically for the chemical imbalance side of it. So because these people lack the neurotransmitters, we give them medications to replace those neurotransmitters. And some of those neurotransmitters include like serotonin, you probably heard about that, or dopamine, norepinephrine. Those are the main three that we try to replace in patients, and sometimes it's a combination of those, 3 or 2 or just 1 at times. To treat the other side of depression that we think is a cause, the nurturing side of it, we set up our patients with a psychiatrist or a counselor.
Hi there. I hope you guys enjoyed our interview with Dr. Garrison and LaCrista Granberry. As you can see, depression affects both the male and female gender, from childhood to the elderly. Ways to prevent depression is talking to a family member, a mentor, maybe even attending religious services, or maybe even calling our National Hotline Center at 1-800-562-3927. Again, that's 1-800-562-3927. Until then, thank you guys for watching. I'll see you guys later.